Good morning, members of the Fourth Estate, and I think once again welcome to these COVID-19 briefings that we've always had. This is our 8th briefing for COVID-19. First and foremost is to pass our sincere and deep-felt condolences to the families of all Kenyans who have succumbed to COVID-19 related health complications and COVID-19 in general. We note that there have been deaths of even popular personalities, the death of the former CS of Health, Madam Cecily Kariuki. We passed our heartfelt condolences to all these families of Kenyans. And for us as a union is that this disease knows no boundaries, knows no social class. It affects everyone from the lowest member of the society to the highest member of the society. With that said, the rallying call is that this is the opportunity to strengthen the healthcare system for all Kenyans to be able to access quality healthcare services. There is a need to ramp up the testing capacity of the country. I think the Ministry of Health came out quite clear when they went to Parliament, to the Senate committee, and highlighted that our testing capacity could get as high as 30,000 per day. We are yet to get to that capacity. In fact, what we have seen is scaling down of the testing capacity in certain institutions. And that becomes an area of concern for all of us with regards to the direction we are heading. On healthcare workers, we'd like to say that so far, yes, we have lost 3 healthcare workers, 1 doctor, 2 nurses. I think that is now known. But what is worrying and what is now beginning to hamper the COVID-19 response is that the number of healthcare workers who are getting infected, going into quarantine and going into isolation is increasing significantly. The state of preparedness in the counties, and more so, the way the disease has now spread to over 44 counties. And we'd like to urge Kenyans that this disease is real. And I will keep reiterating, this disease is real. And we have to take utmost precaution. The more we have an increase in the number of cases, and the more we have more Kenyans going into facilities, you are overstretching our healthcare system, you're overstretching our capacity, you're overstretching the human resources for health. We therefore need to all play our responsibilities. For the citizens, take responsibility by ensuring that you adhere to the measures put in place. To the government, support healthcare workers. Bring on board more healthcare workers to serve Kenyans. Employ the 1,000 doctors we have. Unveil the insurance and compensation package. And this issue of compensation is an issue that is very important, because as we speak, there's a lot of evidence that COVID-19 is no longer a respiratory system disease. It is affecting many other systems in the body. The evidence coming from the European countries and the US, countries that are now 5 months, 6 months, and even China, where it originated from, into dealing with this illness has shown evidence of neurological symptoms, strokes, impairment in memory, movement, heart disease, kidney complications. And all these healthcare workers who are now affected are at the greatest risk of suffering disabilities 1 year from now, 2 years from now, and 3 years from now. So from an occupational safety and health, we urge that, and we are going to put proposals today for consideration by government on occupational safety and health, compensation and insurance for the healthcare workers who are all infected as we speak and will continue getting exposed and infected. And finally, we know and we have come across a Health Amendment Laws Miscellaneous Bill 2020. We have gone through that law, and we'd like to state that the current regulatory bodies, that is the Medical Practitioners and Dentists Council, the Pharmacy and Poisons Board, the Clinical Officers Councils, the Nursing Council, all these regulatory bodies handling professionals should remain the way they are. This bill has originated from the Ministry of Health, and it is saddening that there are people sitting and taking advantage of the fact that healthcare workers are busy fighting COVID to sneak in illegal amendments that will pull away the autonomy of healthcare professionals in the regulation. Our position is that we will not accept illegal amendments and stripping off of the autonomy of healthcare professionals to regulate themselves. That is the message you've put forth. That is our position. And if that continues, and we are saying it, do not start a war with healthcare workers who are currently engrossed in helping this country fight the pandemic upon us, that is COVID-19.